now officially recording, and that we'll be posting the recording on our website, and also will send the recording along to everybody who registered for this session, along with these slides as well. So, you know, we'll make sure to have this recording up for everybody. I also just want to note that our foundation president, Joe Pyle, really wanted to be with us today, but he is actually driving back from being with his son in Arizona. It doesn't have great reception, so he sends his best, and he's really excited about this program and really hopes that everyone here will apply as well. So as for what we'll talk about today, just to give you a little bit of a rundown, we'll give you some background about this grant opportunity, how it came about, some of the history and how we're thinking about it. We'll share some of the eligibility and selection criteria, and then specifically talk about the application process. Then we'll leave about 20 minutes at the end for any questions that you might have. But just keep in mind, like, you can always reach out to myself at to, you know, ask any questions, that this is not sort of the one and only chance that you have for questions. So with that, I will actually turn it over to my colleague, Allison Ferguson, who is the Chief Operating Officer at the Foundation. And she will talk a little bit about our Think Bigger, Do Good policy work, from which this grant opportunity arose. So Allison, take it away.
Hi, everyone. Thank you for joining us this morning. As Caitlin shared, we are all very excited about this new grant opportunity, and I think we're excited for several reasons. One being the topic, which we'll get into a little bit later, but also really for us, it's an opportunity for us to connect our policy and advocacy work through our Think Bigger, Do Good policy series to, you know, bring it back home to our local communities and connect it to our grant making portfolio. So this is the first time we have done this, and Caitlin's going to share more of the specific programming details around it. But so how it's connected to our Think Bigger, Do Good policy series is we've had, you know, this series for about 4 years now. We've been running series with 3 other funders that have, you know, are all behavioral health funders and located in other locations, but really have helped us to kind of build out a national network of authors. And those authors we kind of think of both at the tactician and strategy level. So thinking, how can we have policy papers that are solution oriented and include recommendations that kind of come from an academic place, but really have tangible ways to be implemented and advocated for at local, state, and federal level. So we have a total of 21 papers written and shared so far on a myriad of topics, things from you know, COVID and racism and the impacts on mental health, which we'll spend, you know, a few moments talking about today, to things like payment reform, workforce development, and behavioral health, and kind of everything in between. We have, you know, several papers on criminal justice systems and interaction with mental health systems or the lack thereof, and, you know, kind of a wide variety. So I encourage everyone to kind of look at the policy series, to use it. We're always happy to help folks think about how does the policy documents be integrated into their work, and how can also we begin to learn more about your work in the community and how can that be influencing policy. So, I mean, I really think policy meets practice. The name of this program kind of is a bi-directional relationship that we're trying to have with our policy series and our other programming at Scattergood. Caitlin, do you want to move to the, yep, great. So I'll hand it over kind of to Caitlin to give a little bit more about the goals, and then I'll come back in to set up more about the topic of the paper. You're on mute, Caitlin.
Whoops, sorry about that. You'd think a year into this pandemic, we would get the mute thing down, but such is life. So just to give you a background of the actual policy meets practice opportunity, our goal really here, as Ali mentioned, is to align the work that is outlined in the Think Bigger, Do Good policy series with our local grant making. I think when we first envisioned this, we actually named it Think Bigger, Do Good, Support Local, which we just decided was way too long of a name. But that, we really recognize that all too often these public policy discussions and on the ground practice really operate in very different realms. And that, we also know from our work that the power that can be created when policy is really truly informed by practice, and that good practice can really take shape from strong public policy. So as Ali mentioned, that kind of bidirectional relationship. So this will be our first cycle of grants, and each cycle of the Think Bigger, Do Good, or each cycle of grants will focus on a different Think Bigger, Do Good paper or set of papers. And, Ali mentioned that we have this, wide range of papers that focus on different policy topics related to behavioral health. And we really just see a lot of potential for organizations like yours and for other organizations doing critically relevant on the ground work to really kind of align our grant making to these policy topics. So, Ali will discuss a little bit about the specific paper that we're focusing on for this cycle. But I just want to note, we have some amazing papers and some top of mind issues that really come up are things like reforming the mental health crisis services system, which I think we all saw this fall with the death of Walter Wallace at the hands of police, how desperately we need that kind of reform, and how we know that, grassroots organizations and people who are really having those experiences, with sort of a mental health crisis services system that requires reform, they can really be the voice of why that's critical. And, things like housing for people with severe mental illness remains a critical issue, as does the opioid crisis. So all of these pieces are policy topics that we talk about in the paper that, we see a lot of room for growth in our investments. So just to talk a little bit about sort of what this opportunity will really look like. In our first cycle, we'll be giving a total of 4 one-year $20,000 grants. And each grantee, all of the grantees, our hope is that they will participate in sort of a cohort model where they can be in this community of practice where you can share best practices and challenges, and then also inform our consortium of policy experts on key issues that you're facing, and work with them to, I think also to create that bi-directional relationship and bring their expertise to your work as well. So, our goal is that this community of practice will meet 3 to 4 times a year. We're also very flexible and can build out sort of beyond that community of sort of those set times that we can build more informal conversations for sharing in between those times, but really that opportunity is meant to be something that is very useful for the grantees from this program. And I think, for us to learn from you all and for us to really all learn together. So now I will turn it back over to Ali to talk a little bit about this particular cycle's policy paper of focus.
Yeah, so this policy paper that we're going to focus on this time is COVID-19 Structural Racism and Mental Health Inequities and the Policy Implications for the Emerging Syndemic. It is authored by Drs. Ruth Shim and Stephen Starks, who both are 2 physicians that are well known for kind of their cultural psychiatry. Ruth Shim is at the University of California, and Stephen Starks is both teaching and practicing at the University of Houston. So I'm actually going to the paper was released a couple weeks ago, and we had a webinar that was hosted by our very own Joe Pyle with Dr. Shim and Dr. Starks. And I think the best way for them to for me to explain is to let them explain this idea of a syndemic and how these three evolving, rapidly changing, components come together to really create, issues in our society that everybody on this call are working to address. So Caitlin, do you want to bring up we have a video clip here.
So I'm going to start off my first question to Dr. Shim and Dr. Starks with this question of, what is a syndemic and how does syndemic theory apply to COVID, racism, and behavioral health inequities? And I look forward to this conversation, and thank you for being here today.
So thank you so much, Joe, for that introduction. And I and Dr. Starks are both really pleased to be here joining all of you for this timely and relevant talk. So I think to answer your question, Joe, about what a syndemic is, we can think about it as a concept that was developed by an anthropologist by the name of Merrill Singer. And Merrill Singer was the first to describe what a syndemic was. He described it as the concentration and deleterious interaction of two or more disease or other health conditions in a population, especially as a consequence of social inequity and the unjust exercise of power. And he went on to say that in syndemics, the interaction of diseases or other health problems commonly arises because of adverse social conditions that put devalued groups at heightened risk. And so what we see with the syndemic of the COVID-19 pandemic, structural racism, which has been epidemic since the founding of this country, and mental health inequities, which is another condition that we see this synergistic effect in which these social conditions and disease conditions are all part of the way that devalued groups experience heightened risk and a synergy of negative consequences. And so in syndemic theory, individual epidemics are sustained in a community or population because of harmful social conditions and injurious social connections. And so if we are going to try to think about how are we going to address these conditions, we have to consider the fact that syndemics include epidemics both of the disease and the social conditions that contribute to the proliferation of those diseases. So the idea is that our status quo is to think about trying to address these conditions on a individual basis, or to take one condition, COVID-19, for example, and address that without the context of the other conditions, without recognizing that we have to consider how these conditions all interact with each other if we're going to intervene in a way that actually makes change. And so with that syndemic theory approach, with this idea that we have to address both social conditions, power differentials, social injustice, as well as the disease state itself, Dr. Starks and I have 8 policy recommendations that we put forth in the paper. And they are to protect essential workers and other vulnerable populations, to engage and empower communities, to optimize community-led crisis response interventions, to improve data collection and dissemination, to support school-based interventions, to expand financial support for mental health service delivery, to expand insurance coverage and insurance access, and to promote workforce diversity.
So I'm going to start off my first question.
All right, well, I just want to, if Allie, is there anything else you'd like to add?
No, and I mean, I think the only thing I want to add is, you know, to the points that Dr. Shim was making in the paper, you know, I think the projects we're looking for here are all of those ones that really, you know, value the communities. We know that organizations in our community are having to tackle all three of these things at the same time. They don't live in silos. We know that it's not easy work by any means. It can be complicated and messy, and I think that's what those are the things we're looking for in this program. So that's really all I have to add.
Thank you. So I'm just going to talk a little bit about the grant application process so that you all have all the information that you need in order to be able to apply. So first, to just talk a little bit about the eligibility criteria. First, we are funding nonprofit organizations or organizations that have a fiscal sponsor. And then second, we are really focusing on organizations that are serving communities in the city of Philadelphia. We recognize that many organizations serve kind of across the region, but are focusing on organizations that do serve within the city, even if they may serve organizations outside of the city as well. Then we are focusing on grassroots organizations, which we've defined as having a budget of $1 million or less. We recognize that this isn't a perfect kind of definition, but really wanting to give to organizations that are sort of deep on the ground and have deep connections with their communities. Finally, or not finally, sort of the second to last is that the leadership of the organization, I think in particular because of the focus of this particular grant opportunity, is that the organization is led by Black, Indigenous, or person of color. And then, finally, how does this paper connect, or how does this organization or program really connect to the policy discussion being outlined in the Think Bigger, Do Good policy paper of interest? And, we really did try to intentionally keep this eligibility question broad at the end here, because we recognize that grassroots organizations often are pushing the policy conversation beyond what the policy recommendations might be made in the paper. So, your organization could be doing some practice that, or could be working with communities in a way that really advances these policy recommendations and advances the discussion, rather than sort of thinking that the policy conversation would come first and the practice comes second, where I think in actuality we know that it's typically the opposite. So we hope that you'll really engage with the material and the paper and through the webinar recording, and find your connection to the policy discussion being had. And I think that can be like such a wide range of organizations, either doing the things that are in the paper or organizing around advocating some of the things in the paper, organizing and advocating for things beyond sort of what the paper is pushing. So we really, want to hear from you. I think this whole thing is a learning opportunity. We want to learn and grow with you all. So just a little bit about the overall process. We select the specific policy issue or set of policy papers to focus on for the grant opportunity. And then, we hold we do a request for proposals, which is really the stage that we're in now. And then, we'll do sort of, once we've collected applications, we'll do kind of an initial review, just make sure applicants meet the eligibility criteria before actually passing along the applications to a grant making committee, which is a group there. So we have 6 individuals who, are both from the national space and in here, really work here in Philadelphia, folks who have some who are working really sort of deeply in the community, some who are, have deep knowledge of the behavioral health system, a lot of both, so really trying to draw from different backgrounds of the grant for the grant making committee, and you all we can all of that information is on our website about who those folks are. Then the awardees, that group will do their review of applications and make decisions. We'll announce the awardees, and then we will have some semi-regular conversations and build out that community of practice. So just in terms of what this timing will look like, you know, we are sort of in this phase, in this March phase, where we have this informational session and the grant application is open. So the application will be open through April, or, you know, we're going to close that actually on April 2nd. And then we'll do our internal review of applications, send that along in May, and have grantees announced in May, and then really start this in June. So, you know, we tried to keep a pretty simple application. So, you know, section 1 will really just be information about your organization, you know, things like your mission and budget, you know, just the annual budget size, very basic information. And then in the second session, we have a few questions around just sort of the community that you work with, and then how your organization has worked to build community trust and power. And then finally, in this third section, we'll be asking for sort of a description of what you do, how you have seen your alignment to the Think Bigger, Do Good policy paper. And then we're also asking for a 1 to 2 minute video. And, you know, the reason for this is that we have seen in past programs where organizations provide really even just a person talking about the program to direct to camera, with like, we're really not looking for production value on this, but it really makes the program come to life in a way that oftentimes, like writing a paragraph or a couple paragraphs doesn't. So we really, want to see you talking about your program, or see a program participant talk about what it's meant to them, and just give another way for you to bring your work to life. And truly, you will not be judged on production value. So I just want to be clear about that. All right, so I'm going to actually stop sharing and actually move on to, and I see that there's some things in the chat, which I will get to, but I just want to give a quick sort of like, this is how you actually apply, and through our website. 1 second. So in order to apply, you can go to our website, which is scattergoodfoundation.org. And then the policy meets practice opportunity is under the support section. So you can go directly to that page. And there is more information about the opportunity, links to the paper. We have frequently asked questions and a little bit more right here, where you can click to this user guide. And then you can scroll down to apply now, click that button. And this will take you to our Foundant page, which is our online grant portal. So as you can see here, I'm actually logged in. So I'm going to just sign out and show you what this looks like when I am not signed in. So you can see here that this policy meets practice application is located right here at the top. If you just want to if you don't yet want to create an account, if you don't already have an account, you just want to take a look at the application, you can select preview and just take a look at what's in here, these couple of different sections of the application. And then if you decide you do want to apply, you can click here, log on, and create an account to apply. So this is my sort of an account to just show you what this will look like, actually, one moment. So if you do not have an account, you can click here to just create a new account, and this will direct you to the account page where you'll be asked a little bit more about your organization and create your user profile. And then once you have an account, you can be directed to this page to log in. Go ahead and log in, and then you'll sort of see your applicant dashboard, which will have your information here about the applicant and about your organization. And then you can go directly to apply here, and you'll come back to that page, and that will look, very similar, except you'll find this little blue apply button over here on the right side. So you can hit that, and then you can actually access the application. So you can fill that out at your leisure. As you can see, it is quite short. And you can feel free to come back to it when you are, come back and forth as you're filling it out. So you can just do, if you've done some of it and just want to save it, you can save application, and then once you're ready, you can submit. So that is kind of just an overview of the application. And I just want to now open it up to some questions from folks. I see some things in the chat, and thank you, Ali, so much for putting some of the links in the chat there. And all of that is on our website as well. So yeah, I'll open it up.
Caitlin, this is Eric. Thank you so much for the presentation. One question that I have, two. One was already answered about the video. Maybe you can come back on that. When you say you are not looking at, the quality of production, does it mean that something we can use our iPad in-house and produce? That's number one. And number two, the grant committee, is it going to be different from what we have known in the past when you have the community-based participatory kind of sort of grant-making committee?
Yeah, thank you so much for those questions, Eric. I think, so to answer your first question, absolutely, you can use your iPad, you can use your phone, you can use sort of whatever is available to you to create this brief video. We did this with our Innovation Award, which was an annual award that we recently retired, actually, then, which we created sort of this grant opportunity from. And many of the winners of the Innovation Award, actually their videos were just them kind of like sitting talking to their computer. And it really is not about the production value of the video. It is to us really about finding a way to have your programs come to life in a sort of different way than on a page. So we have just found that having sort of those, both of those options, well, not options, but both of those elements available to folks really allows the program to come to life in a different way. And then to your second question, one of the reasons why we wanted to have a grant making review committee is because of our work with the Community Fund for Immigrant Wellness, which has been, really a participatory process. I will say that this will be a little bit different in that, it is not all folks who are, I think we have 2 folks who are national. So we have, Stephen Starks, who wrote the paper, who's a professor at the University of Houston College of Medicine, and Glenda Wren, who's a member of our board and is a psychiatrist by training. So it is, and then, some folks who are in Philadelphia and sort of deeply embedded in their communities. So, but I think, all in all is just recognizing that like the Scattergood Foundation staff doesn't have all the expertise, and that we, want to make sure that folks who really have this deep expertise can have, power over grant decisions as well. So I would say it's a little bit of, it's a slightly different model, but it draws from from that model. So thank you for those questions.
Thank you, Caitlin.
So I see Douglas, looks like you have your hand.
Yes, Douglas Reed out of Black Men Heal Program Coordinator. Thank you for this opportunity. Thank you for the presentation. I know we started the process for filling out the application. In some of the fields, we were having problem with the characters.
Okay.
It was saying it was exceeding the characters that we were keying in the spaces. So I know that presented an issue for us. So just trying to find out if we're having that problem, who do we contact?
That would be me, and I will take a look at that. So thank you for bringing that to my attention.
Okay, great. Thanks a lot.
Yeah.
I have a question.
Yeah.
Is there a stack? Is this good time to jump in?
Yeah, go for it.
So I put this question in the chat. Spiral Q is in the middle of moving. And because of the need that has arisen, we're talking with developers in the neighborhood about what equity partnership could look like as they're attempting to build an arts corridor out here on Lancaster Ave. And I'm wondering if this grant needs to be for some, pre-existing program that is ongoing that can be looked at, or if it's like, yes, this can support the work that you all need to do, which, includes, these kind of high-level conversations around what a model could look like and the implementation of such, involving community input in the ways that we like to engage our folks. Is this like, hey, this is the work that we're doing and that we feel like is really connected. Is that eligible? Does that seem like a good fit for this?
So thank you so much for that question. I think that's a really important clarification. You can use it, yes, for a program that is already existing or one that you are wanting to get up and running. And I'm kind of, as you were talking, I'm looking a little bit about some of what you wrote in the chat. And I think, this development without displacement, I think, is exactly the kind of thing that would fall into what we're talking about here. So, I'm also more than happy to talk about it a little bit more offline. If you want to have a conversation, more than happy to talk about that. So any questions anybody has, please feel free to reach out. We're always happy to kind of talk through your ideas and your thoughts as you're pulling your application together. So thank you for that question. I think that's exactly the kind of thing that we'd be interested in funding. And I see in the chat here as well a question about budget eligibility flexible for larger organizations that might be under 2 million, but not over 1. We really have kind of tried to pull this down to these, smaller grassroots organizations. I think, we could be open to it, but we will be giving priority to organizations that are smaller in size, in budget size, I should say. But thank you for that question. I'm also seeing a question around an organization that works primarily in Delaware County. We are focused really in Philadelphia, unfortunately, for this particular opportunity. We recognize there are amazing organizations all over the region. And, it is possible that in the future we may move towards more of a regional approach, but that currently we are kind of focused here in the city. So, but thank you so much for that question. I'm open up for some other questions.
So I have one technical question or piece of advice. If you are the person that has not previously done an application in our portal, but your organization has a profile, email Caitlin or myself, and we can add you to the account. So if you go to try to set up an account and it's like, oh, wait, your organization's already set, it might not be associated with your email address or your account, let us know and we can connect them all in the back end. That happens, you know, often. So feel free to reach out if, you know, it's looking like your organization is in the system, but you're not the person associated with it.
And I will drop my email in the chat. And Allie's. Well, folks, I am not hearing other questions. So I, you know, might, unless, Eric, I saw you're off mute. Do you have another question?
No.
Okay.
No. We're good.
Okay. So I dropped the link to the page, and just really hope that everyone will apply. And we really look forward to seeing your applications and to hopefully working with you all. So thank you all so much, and have a really nice day and enjoy the beautiful weather.
Thank you.
Thank you.
Thank you. Bye.
Bye, everyone.